So let me share a story of a woman I saw in the office recently. She had prolapse. She also had bladder leakage, and both of these things are very bothersome to her. She tried Kegel exercises for many years, and she just noticed that the prolapse and the leakage was getting worse. She saw me, and she did not want surgery. However, what she did want after doing her research was to be fitted with something called a pessary. And I went ahead, I fitted her with a pessary comfortably. She felt better. She thanked me, and she's now happier. Many women are not familiar with the pessary and are not aware of this solution called a pessary. And you may be a woman listening to me right now. You know you have prolapse and bladder leakage, and it's getting worse. And you may be feeling embarrassed. You don't want to talk about it. You feel like you have to live and put up with it. You've noticed that you have to push up, bulge in the vagina, or you have to lean forward or lean back to empty your bladder. You've noticed that sex is more uncomfortable recently, and you have the bladder leakage that you now have to wear a panty liner, almost a pad. And know that you don't have to live or put up with it. They're actually good, safe, effective solutions nowadays to help to improve your quality of life, your comfort, and your comfort. So know that you do not have to live or put up with it. They're good, safe, and effective solutions nowadays to help to improve your quality of life, comfort, confidence, and bladder control. And so in this video, we're going to talk about what a pessary is, how it works, and I'm going to do a little bit of show and tell. I brought some pessaries with me so you can see exactly how it works and how it can improve your quality of life. So pessaries are flexible devices that come in different shapes and sizes. As I tell my patients, it's something that goes in the vagina, helps to support a woman's bladder. It can help support bladder prolapse. It can help with bladder leakage. It's fitted comfortably. When it's the right size for a woman, she should neither see it or feel it. It should not be too big that it hurts. It shouldn't be too small that it falls out. Just the right fit. And it's like a device, it's like a diaphragm that goes in the vagina. It's fitted. And when it's the right fit, oftentimes women forget that they have it in place. Now, kind of like a shoe that fits in. Once you leave the store, it's comfortable. You don't have to think about you're wearing a new shoe all the time. And so, yes, it can actually help to, again, support a woman's bladder for prolapse and bladder leakage. And it helps to restore confidence and comfort. And so I actually brought some pessaries here with me, and I'll show you one of the pessaries that we use. One of the more common pessaries is something called a ring pessary. And so as you can see, this is a ring pessary, and it's flexible, so it bends. When we place it in the vagina during an exam in the office, it's placed inside the vagina, and then it's opened up and positioned well. And when it's positioned well, it helps to keep the prolapse in. And this is called a ring pessary. As I mentioned, they come in different shapes and sizes. And this is the same kind of ring pessary, but only bigger. And it really depends on a lot of factors: a woman's size, the degree of the prolapse, that determines which one we use. But usually we, as urogynecologists, fit the one that's the most comfortable one. Again, that's not too big that it hurts, not too small that it falls out, just the right fit. So it's not uncommon when patients see me in the office that we try pessaries to find the most comfortable fit, and then patients that leave home with the most comfortable fitting pessary. So this is a ring pessary, one of the more common pessaries that are fitted. This is a special type of pessary. It's called a dish pessary, and it has a continence knob. What does that mean? So this portion of the pessary actually helps to support prolapse. But this portion of the pessary helps with women who have leakage, right? So it's placed inside the vagina, so it's bent, and it's placed comfortably, scooped into the vagina, and then it's opened up. And when it's positioned, this portion helps to support the bladder for prolapse, and this portion helps to support the urethra closest to the opening of the vagina for bladder leakage. And again, it's flexible, and a lot of women can actually learn how to remove it, clean it, and put it back themselves. So this is a different kind of pessary, and this is called a donut pessary. And it serves the same, it kind of works like the ring pessary, only that this is shaped like a donut. And again, it goes in the vagina, and this we use for women who have more severe prolapse, maybe the prolapse that it starts to protrude outside the vagina more so than maybe this pessaries that are used for patients who the prolapse is not as bad, so to speak. And so, yes, this can help to support a woman who needs more support if her prolapse protrudes more. This is called a donut pessary. And then lastly, again, there are a lot of different pessaries, but this is another one, which is called a Gellhorn pessary. Now, this one is a special one because it has a little bit of a stalk to it, as you can see. And this portion gets kind of bent, so to speak, and then it gets scooped into the vagina. And then this helps support a woman who, we use this more commonly in women who have a uterine prolapse or the uterus is dropping. And this helps to support that uterus. It can also support the bladder as well. But for women who have both, perhaps, then it can actually support the uterus and the bladder very, very well, as you can see. And this is called a Gellhorn pessary. It has a little bit of a stalk, so it looks like a mushroom, so to speak. So they're different. Again, they're different kinds of pessaries. They come in different shapes and sizes. They are safe, comfortable. When it's the right size, it should not be seen or felt. And in terms of care for it, it can stay in for as long as 3 to 4 months at a time. And some women who are perhaps no longer sexually active or don't want to really change it themselves, if you fit it and then see patients back every 3 to 4 months to remove the pessary, examine the vaginal area, clean the pessary in the office, and then place it back. And so then usually I'll tell my patients I'll see them once every season, so to speak, every 3 to 4 months, so to speak. However, for women who are younger, who intend on using the pessary for a period of time, especially if a woman is sexually active, we teach her to remove the pessary. And it's actually easy to learn. And so we'll demonstrate removing the pessary in the office, cleaning it, putting it back, and then have a patient do that in the office. We step out of the room, make sure that she feels pessary is comfortable. Oftentimes my patients will walk around in the room, make sure it's comfortable, maybe do a squat or two, maybe use the restroom to make sure it fits well. If it's not quite the right fit, we remove that pessary, put a new one in, just to make sure it's the right type and size of pessary before leaving the office. And then, yes, a woman is able to learn how to remove it, clean it, and put it back. There are times, the situations may call for that. Perhaps if a woman's still sexually active, while some pessaries can stay in during sexual activity, there's some that cannot due to its size or its position. And so, yes, those women learn how to remove it, clean it, and then put it back after being intimate. And that's something that's possible for women who choose that. And so, yes, this is something that can improve, quality of life, comfort, confidence, and bladder control of the pessary. As I mentioned, while it can stay in for up to 3 to 4 months at a time, I do have patients who remove it maybe once a month, clean it, and then put it back just for maintenance, or remove it once a week on the weekend and then clean it and then put it back. Or once a night, maybe they brush their teeth, they remove the pessary when they're sleeping, lying flat, they don't need the pessary, clean it, and then put it back in the morning after they brush their teeth or before. So there are different ways to manage it. It definitely can be incorporated into a woman's lifestyle depending on how she wants to use it. Good thing is that it's a good solution, a non-surgical solution to address both bladder prolapse and bladder leakage. It can actually also help women who have a rectocele, meaning a bulge of the rectum into the vagina, or a uterine prolapse, the drop of the uterus into the bladder. And you may have seen my previous videos about uterine prolapse or rectoceles. And if you haven't, go ahead and watch those videos. But yes, the pessary can really help with prolapse of all these areas in the vagina to improve a woman's confidence, quality of life, and comfort, and bladder leakage. Thankfully, women nowadays have great options. And if you know of a woman who you feel would benefit from the solution of a pessary, please do like and share this video with them. They will be so thankful for it. Why? Because a lot of women live and put up with this, suffer in silence unnecessarily, don't know their options, and I like the opportunity to be able to help them. And if you know of a woman who you believe would benefit from seeing a board-certified, fellowship-trained urogynecologist, top doctor in Atlanta, I invite you to share this video with them, and I invite you to work with me. 2 ways that you can reach me is through my website. That's www.drtugbiyele.com. That's www.drtugbiyele.com. Or you can reach me through 470-325-1280. Imagine if you're a woman who is listening to me and you have a prolapse and bladder leakage, imagine how you'd feel if you choose to be fitted with a pessary, how comfortable you would feel, be able to do the things you enjoy and not have to put things off because of the prolapse, not have to push up your bladder when you're emptying the bladder, not have to strain or lean forward to empty your bladder, not have to miss out on activities with your family or your kids because of leakage. All these things are possible for you when you work with me. So I invite you to work with me. Again, drtugbiyele.com, and office number is 470-325-1280. Do watch those 2 videos that I mentioned, the one about cystoceles, one about rectoceles, and how pessaries can actually help those conditions. And I will see you in the next video.